Okay, very good. So hello and welcome. We are here with Lori today. This is Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. How are you doing today, Lori?
I'm good.
So we're going to be doing some facial fillers for Lori, and thank you so much for allowing us to share the video.
Sure.
And Lori is an entrepreneur and she wanted to improve some of her aging changes. So we've got her photos here today. You can see how she looks great. We never see ourselves with it, other people see us, but a little bit of the aging changes she wanted us to help us with. If you look in the temples, we get a little bit of the hollows in the face. We're going to be doing some fillers today, some Xeomin for the forehead and the crow's feet, and then also we're going to, later we're going to do the lift. So now we went through our discussion today, we did our consultation, and now I'm going to do a little bit of a cleanse to the face. When I do the cleanse, for the fillers, I like to use the Hiba Cleanse. So this is this pink solution and allows us to, the skin is full of bacteria, which is normal, but we want to minimize some of the surface bacteria, and it is very, very uncommon that you would get an infection from fillers. So cleansing, good technique, and in the very rare or unlikely event that an infection were to occur, obviously give us a phone call and we would prescribe antibiotics, but that is very rare that we would need that. So we do the cleanse ahead of time with the Hiba Cleanse. I also like to use alcohol cleanse. Hello and thank you for joining. For those of you just joining in, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We are doing some facial fillers today with the Bellafill. We're using Xeomin as a botulinum toxin, and then later, at a later date, we're going to be doing the laser treatment, and we're going to be doing the ImageLift, the mid-lift for Lori today. So Lori, what was it that finally inspired you to say, hey, I want to do a cosmetic treatment? What was it that pushed you over the edge and said, you're going to do this?
Just I wanted to improve the way I saw myself, I guess.
Okay.
And it was a good time for me.
There you go. And you have 3 kids.
I do.
And 1 grandchild.
2 grandchildren.
2 grandchildren. So exciting.
Yes.
I'm going to have you rest your head all the way back when I do some of the numbing medicine. This is our little buzzer that we use in the 1% lidocaine with 1 to 100,000 epinephrine. So you feel buzz, then you feel pinch here on your cheek. 1, 2, 3, pinch. You feel big pinch, little pinch, not too bad?
Not bad.
Okay. A little bit of numbing there. Pinch. Lori found us online. She researched us. Did you get a chance to watch some of our videos, Lori?
Yes, I did.
Okay, good. So she's seen some of our videos and she did her homework. 1, 2, 3, pinch. Pinch. I'm not in a hurry. If you need a break, you let me know. What I've found is that little pinches with the numbing medicine just makes the filler much more comfortable. So you feel a few of these little pinches. She's been doing some of her ice
And
as
is
well.
the buzzing just a distraction?
The buzzing is a distraction. The brain can only focus on so many things at one time. Pinch, 1, 2, 3, pinch. And Nina has everything set up perfectly for us. Makes it very easy. Thank you, Nina.
You're welcome.
So we haven't been broadcasting lately. I've been traveling. We had a very nice trip. We went to Alaska and took some time off and spent time with the family. And now, Eric, can you move on this? And now we are ready. We're still on vacation. We get to spend time with people like Lori. And 1, 2, 3, pinch. And share with our viewers. We have a procedure later today. Pinch. 1, 2, 3, pinch. So we'll be treating the temple, the brow with the filler. We're going to be doing the crow's feet and forehead with the Xeomin. 1, 2, 3, pinch. So I'm just numbing. We call this either the marionette line or the melolabial fold. Smile lines. Pinch is another name for it. 4 areas we treat. If we sag, then we tighten. If we lose volume, then we fill, which is what we're doing today. If we get sun damage, wrinkles, and sunspots to the skin, we polish and repair the skin. In the 4th category, outshines everything else. That's our behavior. And none of our treatments look as good as Mother Nature's free facelift. And there are 4 principles. You feel a little bit of a pinch here?
Mm-hmm.
Number 1, you must look natural. Number 2, safety. Number 3, prevention. And number 4, give you as much improvement as possible. So these are our goals for getting natural looking results. Please do follow us on Facebook and on YouTube, and you will see more of these videos. a little pinch here. Pinch. Everything's looking good. So as you can see with the fillers, I do have some patients, it's very uncommon that I'll have a patient that requires relaxing medicine just for the fillers, but sometimes we'll do that. And it just depends on the person. But most people, they say it's easier than the dentist's office. You get a few little pinches with the numbing medicine. Now, do you feel a little bit of a pinch here, a little pinch?
Not much of anything.
Okay. Very good. Okay. Now, what I'm going to do is I'm going to start with when I use the fillers, I'll use them both superficial and deep. And this is the Bellafill that we're injecting today. So you see the filler there. This is a 27 gauge 1/2 inch needle. And so I like to do that to increase the thickness of the skin. Now, do you feel a little bit of a pinch here? Not too bad?
Not much of anything.
So now we're in the smile line or the marionette line or nasolabial fold, and then just thickening the skin, or we see little creases. We just want to fill gently in this area. You want to use a small amount over a large area. I recommend all patients do a 5-minute massage 5 times a day for 5 days. I don't believe it's possible that you hurt the filler afterwards. It helps. And sometimes if you feel a little bit of firmness from the filler, usually the massage will take care of that. Everything's looking good. Thank you for tuning in. If you're just joining, I am Dr. Rich Castellano. We're here in Tampa, Florida, and in the Villages, Florida. I'm a double board certified facial plastic and reconstructive surgeon. And we like to share in our videos for education so people can get an idea of what these treatments are like. You're going to get options here that you're not going to get in other places because of the level of our expertise. We're very proud to be one of the top Bellafill injectors in the United States. We do a lot of this product. We use a lot of the Sculptra and the Radius as well, hyaluronic acid. I use all of those fillers. So you can already see the corner of the mouth, how it turns up just a little bit. I'm going to turn your head forward just a little bit. In through here, so we've filled. She's got a little bit of numbing medicine there as well. We're going to do the other side also. So go ahead and rest your head all the way back for me, please. Thank you very much. And I'm so proud of our team. They really take great care of me, and I feel very loved, and they take wonderful care of our patients too. And it's important. I can't do it by myself. You feel a little bit of a pinch here?
I don't feel anything really.
Okay, me neither. Everything's looking good. So patients today, they want to look natural. They want the least invasive procedure that's going to give them the result that they're looking for. And if we need to come back another day, that's always better than going too far. Almost every day I have patients who come to me and say, I had this treatment done, I wasn't happy with it, can you help me? Can you fix this? You're always better off to do it the right way the first time around. Now in the skin, I'll make a little insertion point here, and that's where I'm going to place the cannula. So I'm doing that in the brow, the temple, and the cheek. I'll do that over here as well. Everything is looking good. So in the cheek, in the temple, and then in the brow, and that just allows us to place the cannula through that little insertion point. And then when we're done, we'll do some of the Xeomin as well to the forehead and then to the crow's feet. Okay, so this is a 27 gauge, 1.5 inch cannula. It's a blunt tip, that's better for safety. I'm going to turn your head to the side here. And so I've already marked the areas. I always like to mark, you'll feel a little pressure, a little pinch. Pressure, pinch. And I like to use the twist technique to advance the cannula. Do you feel a little pinching there?
Tiny.
So when you do the twist technique, it's easier for the patient. It's less discomfort. And I'm using the shiver technique now. The shiver technique just allows micro fluctuations in the pressure on the plunger of the needle, and that allows you to very slowly and delicately inject the filler. Every injector has had the experience where you put pressure on the syringe and sometimes you might get a bulge of the filler come out, but what I do with the shiver technique, you just do tiny, tiny, tiny little bulges. So you just get a little bit here, a little bit there. It's like throwing seed on the grass. You want to use a very small amount over a large area. Lori, how are you doing, dear?
I'm good.
Very good. Everything's looking good.
That's the intention.
That's right. Look good, feel good, do good. That's our motto. Now, we also talked to Lori about festoons. She has a little bit of festoon here, and there's a little bit of allergy symptoms that she has with her animals, and laser resurfacing does the best for that. And we've talked a little bit about that. Also, avoiding allergies as much as possible. Things that cause allergies, it's not easy to completely get away from that. You can also do desensitization therapy as far as sublingual allergy treatment, sublingual immunotherapy. Perfect, that's fine, thank you. Everything's looking good. Lori, how are you doing, dear?
I'm good.
Good. So our goal is to demonstrate this is how we do fillers, this is how we, patients tolerate it, they do very well. We're very proud to teach how we do our filler techniques. And if you are a doctor or a medical student watching, please look up our Practice Profitability MD site, where we love to teach about our protocols and strategies to help give patients the best experience. And when you know how to run a better business, you become a better practitioner. And too many doctors today, they're kind of lost when it comes to business practices. They don't even realize the issues that come up. Over 20% of cosmetic practices go out of business. I think many more, the number's higher than that, and many more are hanging on by a thread. So a lot of doctors out there, they know how to take really great care of their patients, but they don't know how to put the systems and processes together. Or really, more importantly, build the team, because that's a huge limitation if you don't know how to build your team. Lori, how are you doing, dear?
Good.
Very good. So we keep it that simple. You can see that she's going to pass the grocery store test today. She walks into the grocery, no one does a double take. Now I'm going to do some across the brow. If you look at your photos in your 20s or 30s, then you will see, okay, here's where my volume was when I was younger. You feel a little pressure, a little pinch across through here. So my cannula goes through the length of the brow, right through there, okay? And then I use my little shiver technique to just put a very small amount. And we are just trying to build back up the orbital rim. We lose bone as we get older. We get a little bit shorter, and the bony prominences, the brow, the cheek, the back of the jaw, and the chin, they erode down. So now we're just putting that volume back in. So now that I've done some of that injection, then I just do a firm massage, make sure it's nice and even, and I'll flatten the filler out just a little bit, because that gives you a gentle increase in the volume over the entire area. Everything's looking good. A little pressure, a little pinch here. Shiver technique. I love to use a shiver technique because it's very gradual, it's very measured in the amount of filler that we deliver, and I tell injectors when I'm doing the training that if they have a tremor, they can just tell people they're using the shiver technique. Lori, how you doing, dear?
I'm good.
Very good. Thank you for watching. Thank you for tuning in. I am Dr. Rich Castellano. Please follow us on social media, facebook.com/ImageLift, and we're on youtube.com/ImageLift, Twitter, we're on all the social media. Okay, very good. I'm going to do the same thing on the other side. We're going to keep sculpting in the cheek as well. It must look natural. Everyone is different. We're different in our anatomy, we're different in our expectations, we're different in the way we respond. It is always better to come back another day and do more rather than go too far. So I just like to make sure it's a very even distribution. And some of my patients, they don't do the massage afterwards, which is fine. It's preferable, but still they'll get good results. But it's preferable to help. If you feel a firm area, you can, I'm going to turn your head to the side. You can massage it down. Perfect. You feel a little pressure, a little pinch across through here. A little shiver technique, and just gently spread that product through. Now, the more I inject, the more numb Lori will feel too, because there's numbing medicine inside of the filler here. Okay, so I've done some across the brow, and that does give us the best way that you lift the brow is to reinflate it. I think surgical brow lifts are often overdone, and so if you look at our pictures when we're younger, the brow is actually not high, the brow is actually low. And so it doesn't really look that natural to just lift someone's brow up. It can help some of the aging changes, but better yet is just put back what was already there, put the volume back, and oftentimes you eliminate the need to do a surgical brow lift, and that's really what people want nowadays. They don't want surgery if they can avoid it. Now, if they really want that result, sometimes the lifting procedure is the right decision, but fillers are the future of plastic surgery because they prevent as much as possible and they stave off the need for lift. But then when someone does the pull in the mirror and says, hey, I'd really like to get some nice improvement, it's very difficult to compete with what the lift will do. There are the non-invasive, non-surgical lifting options, ultrasound, radio frequency, but they still don't get the same results as what a lift will do. And there's a popular study that was done a few years back that showed about a third of patients who did the radio frequency energy, they said, hey, I like my results. A third of them said, not so sure, and another third said they were unhappy. And that's just a lot of unhappy patients for they're spending thousands of dollars on those treatments. So as we say, the biggest side effect from some of those super minimally invasive treatments is eye strain, because we look at the before and after pictures and we're straining our eyes trying to figure out where the difference is. So we want to make sure we see a difference. Lori, how you doing, dear?
I'm still good.
Now what I'm going to do is I'm going to have you face forward as if you're talking to someone straight ahead. Good. So I like the volume I see, and there's a little bit of swelling through here. I'm just going to hold a little bit of pressure. Good. So what I'm going to do now is I'm going to build up a little bit around the cheek and rest your head all the way back for me, please. Good. I'm going to hold a little bit of pressure. And you can just massage these areas. Perfect. The cannula, please. Thank you. I'm going to turn your head this way. And you hold some pressure right there. That's perfect. Thank you.
You're welcome.
And I'm going to build up ever so slightly in the cheek. I also build up in what I call in the submalar region, just for balance. You want a gentle contour increase in these areas. So shiver technique. You feel a little bit of a pinch there, Lori?
Not much, but a little.
So the cannula is very atraumatic. Less bruising, less risk. The risk of getting that filler into a blood vessel causing other problems is very, very low when you know your anatomy, when you use a cannula, when you have an expert injector, and you're going slowly and using small amounts. All of those strategies will keep you safe. Very good. So to advance, it's always easier to do that little twist technique.
How long does the product last on a person?
The Bellafill is made up of 80% collagen and 20% PMMA. The collagen gets absorbed and replaced by our body's own collagen, and the PMMA is permanent, is non-absorbable. If you read the FDA approval, hello, thank you for tuning in, Areda. So the FDA approval says that it is non-absorbable. Once people do fillers long enough, they always say the same thing when they turn your head to the side. They say, don't you have something that lasts a little bit longer? Let me turn your head a little bit more here. And that is the longest lasting filler. Sculptra is also a good long-term filler. A little more gradual in its results because you have to wait 3 weeks to even up to 6 months. You'll see continued improvement with the Sculptra. So now I'm just doing the twist technique for the submalar region. I want to build that area to balance the contouring, so I'm just doing 0.2, 0.3 cc's of filler in these areas. Thank you for tuning in. Please do follow us on ImageLift. Also look us up at practiceprofitabilitymd.com. We love helping other doctors make their practices more successful because they don't teach us the business practices in medical school. Very good. Lori, how are you doing, dear?
I'm good.
So now I'm just building the zygomatic arch right in that region. The cannula is all the way up top over here, and then Perfect. I'm going to do a little bit more in the cheek as well. A little pinch through here. Thank you.
You're welcome.
Let me turn your head to the side. Perfect. So you can already see how the volume is doing a good job. As I say, I tell patients you don't want to taste the chocolate cake before it's done baking. It doesn't taste that good yet. But she does look good, and she'll be a tiny bit swollen, but it's not the final result for her just yet. If a patient has more swelling than what they anticipate, very rarely do we call in a Medrol dose pack to help reduce swelling, but that is an option because some patients just have different exposures, different sensitivities to seasonal allergies, things like that, pet allergies. Laura, you doing okay, dear?
Yes, I am.
Perfect. Thank you for being such a great patient. We haven't had to give you any warnings or anything like that. I'm just kidding. We don't give warnings. We make sure patients are comfortable. I'm going to do a little bit more in the chin here as well, but I'm just doing some in the cheek and balancing on both sides. If we need to come back another day and do a little bit more, that's always better than going too far. We will not go too far. And then just building up here in this little triangle, we lose volume through here. So now we're just building up. And when we do the lift, it does help in this area as well. So this is bone loss that causes this type of hollowing, and it changes the shape of the mouth. So now we're just building up the soft tissue. I'm going to turn your head this way, nice and easy. And you have the Xeomin for me. I don't recommend any restrictions in activities. I think that the normal activity, normal lymphatic drainage and movement of the tissues is fine. It's very difficult. I think it's almost impossible when the fillers are placed correctly that someone can hurt the fillers by their activities. Now I'm going to do a little bit of the Xeomin. So I'll use my buzzer again. You feel this area, you probably don't feel that much. Feel a little pinch here. 1, 2, 3, pinch. 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 Very good. You doing okay, Lori?
Yes, I am.
Very good. So we keep it simple. Pinch on 3. 1, 2, 3, pinch. 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 And pinch. So that's in the crow's feet area, which helps soften some of the crow's feet. It also gives a little lateral lift to the brow. Botox, Dysport, and Xeomin all have very similar efficacy. Some patients have their favorites. Raise your eyebrows up real high for me. Now it'll be harder to raise the brows just because we did the numbing medicine. Pinch, 1, 2, 3, pinch. So I just like to use very small amounts. Pinch. Pinch. And now you turn it this way. Perfect. Pinch. 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 How are you doing, Lori?
I'm good.
She's tough. Lori has a horse. I found that people who work around horses or anyone who comes from a farm, they're just tough by definition. You can't be wimpy and work with horses.
No, you can't.
Raise your eyebrows up real high. Now relax as best you can. Pinch. And I tell patients 2 weeks after they do their Botox, Dysport, or Xeomin, if they think they need a little touch-up, come back, and we can do that. So if you come back earlier, you may still be getting some result. So, okay, let's take a look here. So, let's have a look in the mirror. So can you see how the volume fills in these areas around the cheeks, temples, and brow? A little bit of swelling just yet, and then around the mouth. Make a big smile for me. So she'll pass the grocery store test today. We'll have some ice for her. Everything looks really good. How does it look so far?
Good.
Okay. So, and just for comparison, we'll show you here. Lori looks great before. She looks great afterwards. But you can see she's got a little bit more contour in the cheeks, a little more hollows from before. And now we've kind of filled those areas. I like to call it like re-inflating. And she will look natural if we're lucky. Aging keeps coming. So now we're fighting that process by putting the volume back in place. So thank you everyone for watching, and we'll have more soon. Thank you so much, Lori.
Thank you.
You did great. We're very proud of you. And more videos to come soon. Thank you all. See you soon. Bye-bye. Finish with this one and then finish here. So